Yeah, thank you, Melina. So thank you, Carlos. I think this previous work segues nicely into what I'm going to talk about, which is the way we pose the question regarding what should the technical skills in FLS look like given the direction we're moving in, and how we pose that to the general laparoscopic community and the responses we received. So I have nothing to disclose. So I'm going to start with two assumptions we made as a group looking at these questions, that educational experience in laparoscopy and the competency expectations that have evolved since FLS's inception, which you're talking 2 decades ago, is important, and that laparoscopic surgery performed at a basic or fundamental level can be characterized as an initial step to update any of the technical skills aspect of our test. So our committee convened a working group that brought together subject matter experts from 12 North American institutions. This covered pretty much the gamut of clinical laparoscopy, general surgery, gynecology, surgical educators and scientists. And using the nominal group technique, which requires multiple passes of consensus making facilitated by experts, that allowed us to identify specific competency domains and specific competencies under these domains that define the essential characteristics of laparoscopy performed at a basic level. So these are the specific domains we came up with, and they should look familiar to anyone who performs clinical laparoscopy: setup, abdominal access and port placement, basic laparoscopic and instrument use, tissue management, and management of the operative environment. So under these competencies, this very busy slide shows the 65 items that were identified as essential when considering a basic laparoscopic construct. And again, this should look familiar to anyone who performs clinical laparoscopy. We have under setup, basic positioning, and other considerations regarding the equipment. Abdominal access and port placement, it's going to be things that any basic laparoscopist, if you're involved in resident training, you're going to have to know how to do. Laparoscopic instrument and laparoscope use, and tissue management, which comprises the greatest number of these competencies. And looking at these, it makes perfect sense. This is going to be the basic ways we interact with tissue: division, dissection, use of energy instruments, and the safe operation of the instruments when doing things that are very procedure specific, such as performing biopsies or removing specimens. And then the group also included management of the operative environment, which, looking at these things, you might consider some of the elements to be non-technical in nature. But in fact, even though these involve activities that might include teamwork and decision-making, there's enough that has to be done that qualifies as technical that our group decided they should be included in consideration of technical laparoscopy. So from these items, we put together a survey which rated each of the 65 elements according to importance, frequency, and prioritization for testing in FLS. It was distributed to the entire SAGES membership, to the Association of Program Directors in Surgery, to recent successful FLS test takers, and 2,336 of these lengthy surveys were opened of a distribution of just under 7,000 surveys. So by that measure, the response rate was 34%, although a somewhat smaller percentage were completed either nearly entirely or in their entirety. Of these, we decided to hone in on those who might give us perspective on basic laparoscopic constructs, those who are post-training. The practicing surgeons, we included fellows, so that dropped that number down to about 1,143 surveys, which we included for primary data analysis. This included general surgeons and colorectal surgeons, and a much smaller number of other specialists, including gynecologists. Performing a Pearson correlation analysis of the 3 response aspects, importance, frequency, and prioritization for testing, there's a very high degree of correlation between the aspects, and that we felt enabled us to legitimately focus in on prioritization for testing, which was the principal task that was put before the working group. So looking at those competencies which rose to the median or the 50th percentile for responses at the highest response level, we identified 17 competencies which scored the highest for prioritization for testing. And these are grouped by domain here. I'm not going to go through them individually, but I will say that 8 of these were, I think anyone looking at them would say, these are the basic manipulative skills that are used when interacting with tissue that unequivocally would be the sort of things that classically we have included under technical skills, although the range of competencies identified really went across a larger scope of activities. Mapping these to the current FLS tasks, we found that looking at the current tests individually on the left side, that these mapped to multiples of 5 of the 8 competencies. The 3 that didn't are obviously things that are not tested in FLS, but I want to point out again that the survey outlined a much larger scope of activities that would fall under the description technical, which are worthy of consideration as we move forward. So I know a few of the concepts have been mentioned. I do want to include, as we look forward to FLS and its future evolution, that I'll say the technical skills testing will be incorporated into a competency-based education framework, which is much larger in scope than our current view of the test, and that changes to the current skills tests or adding new elements to the skills test have to be carefully planned and validated to ensure its relevance to the FLS purpose and to the anticipated candidates who will be seeking certification. So thank you.